Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Acute appendicitis. So acute appendicitis is nothing but clinically there is tenderness. The tenderness is present at a particular point known as the Merck-Bernays point. So it is the Merck-Bernays point. And the USG, if you see, it includes the acute appendicitis and the graded compression USG. So this includes normal appendix. If you see, this is compressed, and acutely inflamed appendix is also inflamed appendix. This is acute inflamed appendix is seen. There is a non-compressible, it is non-compressible, and there is a peristaltic, it is blind ending, as well as they have a presence of a tubular structure. To learn and grow daily like this, please do subscribe.